What is cost of care? This presentation is for individuals, families, and professionals connected with an area agency. It is presented by Granite State Independent Living's Financial Planning and Benefit Services. Please note that this presentation is focused on programs for adults 18 and older. If you receive services from an area agency, for example, consumer-directed services, day services, residential services, respite, then you receive what is called home and community-based care services. What is cost of care? If you have a home and community-based care waiver for a person with developmental disabilities or acquired brain disorder, and you are over the income limits to receive Medicaid without a cost. Cost of care is the out-of-pocket amount, like a deductible, that you are responsible for paying to an area agency before Medicaid will cover your services with the area agency. Please note that the notice that you receive that states what your cost of care is generated by the Department of Health and Human Services, DHHS. But the area agency is the one that will be billing you, and you have to pay the area agency that amount. Who may have a cost of care? If a person is still receiving cash assistance, you will not have a cost of care. If a person is still receiving a SSI cash benefit, you will not have a cost of care. Or if a person is receiving Medicaid under Medicaid protection through SSI, because their SSI cash benefit is now zero, they will not have a cost of care. If you have a Choices for Independence, CFI, or In-Home Supports, IHS waiver, you will not have a cost of care. Cost of care is applicable in cases when a person is receiving an SSDI cash benefit over $883 per month. How is cost of care calculated? To calculate cost of care, first they're going to bring in your gross earned income, and they're going to deduct the applicable disregards or deductions. Please note that if someone is working, they should not have a cost of care. Okay? So I'm not going to go into detail of what the deductions are or what they mean at this time. The second step is you're going to add in your gross unearned income, and that includes SSI. Unearned income would be SSI, SSDI, unemployment, workers' compensation, and so forth. Please note that SSI is subtracted in a later step. Next, they're going to subtract allowable deductions. An example of allowable deduction would be court-ordered child support, court-ordered alimony. They're going to subtract a $148 personal needs allowance if the individual lives in an independent living arrangement. Okay. Next, they're going to subtract the standard of need, which corresponds to the individual's living arrangements. If they live in independent living, it's $735. If they live in residential care facility, it's $915. If they live in a community residence that's subsidized, it's $797. They live in a community residence that is unsubsidized, it's $857. If they live in enhanced family care, it's $915. Now they're going to subtract all Medicare premiums the individual pays for themselves. If the state pays your Part B premium, it cannot be deducted. Subtract all other medical expenses incurred by the individual that are not subject to third-party payment. This means that anything you pay out of pocket for, whether you've just incurred the bill, which means you haven't paid it, or if you actually paid it, can be deducted. For example, that would be health insurance premiums, deductibles, co-insurance or co-payments. Then they're going to subtract the SSI, and then they're going to add in the VA aid and attendance allowance if it is applicable to your situation. That's going to result in the cost of care. For example, Steve receives SSDI of $1,000 per month off his father's record. He has no earnings and lives in independent living. His Medicare Part B premium is paid by the state, and he has little to no out-of-pocket costs. The first step is earned income. He has none. Okay, so we're going to skip to the second, which is add his unearned income. His unearned income is $1,000. Now going to subtract allowable deductions. Steve does not have any, so his countable income is still $1,000. We're going to subtract his personal needs allowance. Remember, he does live in independent living, so we're going to deduct the $148 to equal countable income of $852. We're now going to subtract his standard of need. He's in independent living, so that's $735, and that's going to equal countable income of $117. The state pays his Medicare premium. He has no medical expenses. He doesn't have SSI, and the VA aid in attendance is not applicable to him. So his cost of care is going to be $117. Okay. For the second example, Lincoln receives SSDI of $1,200 per month off his father's record. He lives in a community residence. His Medicare Part B premium is paid by him, and he has little to no out-of-pocket costs. He has no earnings, so we're going to skip to step 2. We're going to add his unearned income, which is $1,200. We're going to subtract allowable deductions. He doesn't have any. We're going to subtract a personal needs allowance. He lives in a community residence, not independent living, so he doesn't have a personal needs allowance. We're going to subtract his standard of need. He lives in a community residence that is subsidized, so it's $797, and that's going to equal countable income of $403. We're going to subtract his Medicare premium. He does pay his Part B of $104.90. That's going to equal countable income of $298.10. He doesn't have any other medical expenses. He doesn't have SSI, and the VA aid in attendance isn't applicable to him. So his cost of care is going to be $298.10 per month. Can you get rid of your cost of care? If you are a person like Stephen Lincoln in the previous examples, and you are working, you can get rid of your cost of care. There is a program called Medicaid for Employed Adults with Disabilities, or MEAD. You can enroll in this program, and you will no longer have a cost of care. MEAD gets rid of your cost of care because the eligibility requirements are different and allow a person to have more income. Now, there can be a premium for MEAD, which you can see in another presentation on Medicaid, but you would not have a cost of care. Want more information? Here's how you can get more information. You can listen to the rest of the videos. You can contact Granite State Independent Living for assistance. The Financial Planning and Benefit Services phone number is 877-809-7028, and our email is benefits@gsil.org. The website for GSIL is www.gsil.org. You can visit the New Hampshire Work Incentive Resource Center for more resources at www.nhwirc.org. You can contact Social Security Administration and/or New Hampshire's Department of Health and Human Services for more details. Social Security's website is www.ssa.gov. The Department of Health and Human Services website is www.dhhs.state.nh.us. If you're connected with an area agency, mental health center, or vocational rehabilitation, you can contact them for more information and assistance.